All right. Hello, everyone. Good evening. Good morning. I'm Joanna Cohn. I'm Director of the Institute for Global Tobacco Control at the Johns Hopkins Bloomberg School of Public Health. I want to welcome you to our Innovations in Tobacco Control lecture series. And today I'm really delighted to be able to introduce our speaker, Rijo John, who's an economist and public health policy analyst based in Kerala, India. Dr. John does independent research and technical consulting for several institutions, including the World Health Organization, the University of Illinois at Chicago, and the Campaign for Tobacco-Free Kids, among others. He is also an adjunct professor at the Giri College of Social Science in Kochi and a guest faculty at the Indian Institute of Management, Kozhikode, in India. And he formerly worked as an assistant professor of economics at the Indian Institute of Technology in Jodhpur, as well as at the University of Illinois at Chicago and the American Cancer Society in Atlanta in the US. Dr. John's research focuses on evidence-based public policies related to the regulation of tobacco, alcohol, and sugar-sweetened beverages focused in low and middle-income countries. And he's been working in this area for almost a couple of decades now. I think his first publication was while he was doing his, or just after his master's degree, or I think before the PhD was awarded. So has been working in this area for a very long time. His PhD is in economics from the Indira Gandhi Institute of Development Research in Mumbai, and he did a 2-year postdoc fellowship at the University of California in San Francisco. And then interestingly, he also, in addition to his tobacco and sugar-sweetened beverage work and alcohol, he also has published daily analyses of India's COVID-19 data on his Twitter handle at Rijo M. John, which is widely followed. So certainly, up with the latest trends. So, but today, Dr. John is going to be speaking to us about goods and services taxation and affordability of tobacco products in India. So Dr. John, welcome, and thank you so much for joining us today.
Thank you, Dr. Cohen. That was a kind introduction. Let me share my screen and go ahead with the presentation. So, can you see my slides here?
We see, yeah, that's perfect. Excellent.
Okay, great. So yeah, so as Professor Cohen already spoke, my intention today is to speak about the goods and services taxation in India, and with special focus on how it applies to the tobacco products in particular, and how the taxation structure for the tobacco products has changed, from the pre-GST era to the post-GST era and until now. And then I'll also present a paper which we recently published on some main findings from the paper, which actually looks at how the affordability of these tobacco products have changed, especially post-GST years. Now, why I focus on GST is because, GST, the goods and services taxation as it is called, has been a major overhaul on the indirect taxation scenario in India. And just as the taxation for every other commodities and services changed, the taxation structure and its nature itself has changed for tobacco products also. And that there's a major change. So it's like a major event. So it really makes sense to sort of talk about the pre-GST situation as far as tobacco taxation is concerned, and distinguish that with the post-GST situation, and then look at where it is trending in terms of how affordable the products are. And I'll also discuss some remaining challenges as of today when it comes to taxing tobacco products in India, especially in the backdrop of GST. So let me begin with a little bit of background for people not from India about tobacco in India. I mean, you know, India is a huge country. You know, it's a 1.4 billion people. So obviously everything related to India should be gigantic in size. So India is the second largest producer and consumer of tobacco in the world. I mean, it's really large. I mean, we have 28.6% of our adults using tobacco in some form, and that makes it 270 million adult tobacco users. That's almost 80% of the US population, if you may. And the recent global youth tobacco survey also says that about 8.5% of the children who are in the age group 13 to 15 years use tobacco in some form. I emphasize the word some form of tobacco because unlike in the West, you know, in India, tobacco is used in a variety of forms, both smoked and smokeless varieties. In fact, smokeless tobacco use is more prominent. As you can see, there are 200 million smokeless tobacco users vis-a-vis only 100 million smokers. And even among smokers, you can see that it's not just the cigarettes that we're talking about. In fact, cigarettes constitute only a very small proportion. About 15% of the smokers are cigarette smokers, and the rest of them are BD smokers. BD is a sort of a local version of the cigarette, if you may, but it's really not the look and feel of it is completely different from cigarette. It is wrapped in a tendu leaf and tied with the thread. So it's very different from cigarettes in many ways. And the burden of tobacco use in India is extremely high. About 1.35 million deaths are attributable to tobacco use every year. And I don't need to tell how, what are the major risk factors for non-communicable diseases like, cancer, cardiovascular diseases, diabetes, and chronic lung disease. And we know that, tobacco use is a major risk factor for many of these NCDs. By the way, in India, 63% of all the deaths in India is accounted for by the non-communicable diseases. And this percentage itself has been on a rise. 27% of all cancers also can be attributed to tobacco use in particular. There were two studies that actually looked at economic burden of tobacco. Both were done by myself and my colleagues. One was looking at the overall economic burden from all tobacco use, and we estimated that it was around 1,773 billion Indian rupees. To make sense of this number, it was about 1.04% of the GDP or the gross domestic product annually. Now, we also estimated the economic burden only from BD smoking, and that amounted to 805 billion Indian rupees in the year 2017. Now, again, all these estimates are underestimates in the sense that, we have made these estimates only for the people 30 or above. So there is a sizable proportion that is left out. But in any case, there is no argument that economic burden is extremely high from the use of tobacco, and compare that with the kind of tax revenue that the tobacco brings in to the government is very low. So let me now get into the taxation. Before the GST happened, the GST actually happened in the year 2017. And, the indirect taxes typically, it used to be run by both the union government, which is the federal government, and different state governments. And it was the federal government that used to impose an excise duty on all tobacco products. Whereas the different state governments would apply, different sales taxes. We used to call it a value-added tax, or VAT, in India. And this VAT would typically vary from each state to state, and also from product to product. I mean, depending on whether you're talking about BDs or cigarettes or smokeless, the VAT would be significantly different. Similar story with the excise. Of course, excise is, because it is applied by the federal government, it will be the same across the country. But the rate itself would vary by different products, depending on which tobacco products that you're talking about. Now, apart from the excise duty and the VAT or the sales tax, there used to be a plethora of different kind of cesses or additional duties. I mean, you call it. I mean, there are many kind of names associated with this. Sometimes they call it a health cess or an education cess, or a BD workers welfare cess or national calamity contingent duty. So there used to be like too many types of taxes that used to be applied as part of this taxation, making it extremely complex for any ordinary person who looks at this structure itself. Now, here is just to give you a glimpse of how the taxes used to be applied. You can see for something like cigarettes itself, the taxation would vary depending on whether you are talking about a cigarette with a filter tip or without a filter tip. And also within each of those, the taxes would vary depending on the length of the cigarettes. So you can see that the 6 different tiers for the purpose of taxation on cigarettes itself. And again, for BDs, there used to be distinction between handmade BDs and machine-made BDs. And then, of course, you have a variety of smokeless tobacco products. I'm just writing just an average figure, an average tax figure for all these smokeless products combined. But in reality, there are a number of them, and the rates sometimes can vary very significantly. So this used to be the situation prior to the GST, and all these taxes were part of the central excise or the part of the federal taxation before the GST. Now, to give you an idea how skewed this taxation structure itself was, you can see that out of these total excise taxes applied by the federal government in India, about 85 to 86% of the contribution of these taxes came from cigarettes alone. On the other hand, as I earlier indicated, cigarettes consumption itself constituted only about 15% of the smoking, let alone smokeless. So in fact, if you look at it as a percentage of the total tobacco consumption, it is even lower, right? So what we are seeing is that a product that is the least used, a cigarette, which is the most taxed here and bringing the highest amount of taxes, contributing to almost 85% of the total tax revenue by the government. Whereas most widely used products like chewing tobacco, smokeless tobacco products, or BDs had very little taxation. And this was a situation before the GST, high discrepancy in taxation. And this was the taxes applied by different state governments prior to the GST. This is called the value-added tax. And as you can see, again, there is a discrepancy in value-added taxation with whether on, depending on the product that you're looking at. And of course, it also widely varies between different states. And what I have put up here is just an average across the different states in India. Now let me come to the goods and services taxation, which was introduced in the year 2017. What happened was when the GST got introduced, all these, excise, VAT, and all these different other type of taxes that I discussed earlier, they all got subsumed into a single tax called the GST, Goods and Services Taxation, except one thing, that was NCCT, the National Calamity Contingent Duty on Tobacco Products. That was the only component of the pre-GST tax that did not subsume into the GST. Now, the GST, by the way, is sort of a, the GST, the decision of taxation within the GST was decided by, or is decided by, the GST Council, which, by the way, consists of not just the union government, the federal government, but also the representatives of each state governments. So basically, it's a council for taxation, which has representatives from both the federal and the state governments. So any kind of decision within the, for any kind of decision on indirect taxation, or let's say changing the taxes on tobacco, would require a consensus within the GST Council. Now that's quite different from the pre-GST era, wherein the federal government could unilaterally increase the taxes, excise tax component at least, and the state government, each of them could, at their own whims, could change the VAT rate on different tobacco products, and they indeed used to do that also. Now, the GST Council on the May 18th, 2017, they fixed the GST rate on each of the tobacco products. As you can see, there was a 28% GST that was applied on all the tobacco products, including cigarettes, BDs, and smokeless. But unfortunately, the GST Council itself, when they decided or fixed the tax structure on tobacco products, they, instead of making it simpler, they decided to go the other way around. They made it actually far more complex than before. Although we say that a lot of taxes got subsumed into the GST, in effect, it became much more complex. And I would explain why that's the case sooner. Let me take you to the GST structure that was decided when the GST got implemented. That was, as you can see, there is this first column which applies a 28% GST standard across all the tobacco products. And then, as I indicated earlier, the NCCD, or the National Calamity Contingent Duty, did not get subsumed into the GST. And these NCCDs are basically, these are specific taxes. Basically, when you're talking about cigarettes and BDs, these are taxes per 1,000 sticks of BDs or cigarettes. Okay, this is basically 90 rupees per 1,000 sticks of non-filter cigarettes with less than 65 millimeter in length. Okay, and again, as you can see, there's quite a discrepancy. It varies between the type of products. And then, apart from the NCCD, the GST Council also decided to impose what is called a compensation cess. And this compensation cess was brought into the place so that, because all the states were moving from the pre-GST era to the post-GST era. And in the pre-GST era, the many states would impose taxes on their own, and now they are not able to do that. So because of which it was estimated that some states would potentially lose some tax revenue. They would not probably earn as much tax revenue as they were before, and some might be earning more. So the compensation cess was a concept they brought into the GST so that the federal government agreed to compensate the states for any kind of revenue shortfalls that they would experience for the 5 years, up till 5 years after the introduction of GST. That was the reason why the compensation cess got introduced. And this particular compensation cess was applied only on certain products like cigarettes, tobacco products, or some luxury commodities or aerated drinks, etc. So a few select commodities, including luxury vehicles, etc. But then, interestingly here, while they applied this compensation cess on all the tobacco products, they kept the BDs out of it. So BDs, as you can see, has only this 28% basic GST applied, whereas for cigarettes and smokeless, they have this compensation cess over and above the GST that's happening. Now, you can see that this compensation cess itself is actually a larger component of the total tax applied to cigarettes compared to this 28% GST. So, I have the numbers I'm not presenting here, but it suffices to say that the 28% GST itself was contributing to a smaller chunk of or a smaller share of the total taxes or total tax burden on these tobacco products, whereas the specific cess or the ad valorem cess or compensation cess together was constituting the major chunk. Again, within the compensation cess for cigarettes, you can see, interestingly, they have a specific component as well as an ad valorem component, making it even more complex. So an ordinary person looking at these numbers, it would be very difficult to make sense of this kind of a structure. Earlier, pre-GST, the structure was not as complicated. At least for cigarettes, for example, we just had a specific taxation, only specific taxes, whether it was GST, whether it was excise duty or VAT, they all used to be specific in nature. Now we have a mix of ad valorem. The GST itself is an ad valorem tax, whereas then we have compensations which has both specific and ad valorem components. And then you also have NCCD, which is specific in nature. But for smokeless, all are ad valorem. Now, we made a comparison of how the tax burden, when I say tax burden, it's a total tax burden, which is essentially, you look at the taxes as a percentage of the total retail price. Okay, the total tax as a percentage of the retail price. I compared the tax burden just before the GST. 2017-18 was a financial year in which financial year prior to the GST, and post GST. Actually this year is wrong here. It should be 18-19. It's just a year after the GST. So my purpose was to compare the tax burden right before and right after the GST, and you can see that there's hardly any difference in tax burden that happened to the cigarettes. There is a slight increase in the tax burden on BDs. Despite imposing only 28% GST, the tax burden has indeed increased for BDs. Smokeless tobacco also saw a small increase. Now, in fact, we did a paper. I mean, we did a study with myself and Dr. Estelle Dauchi from CTFK. We did a simulation exercise, actually looking at how the GST would impact the prices and consumption at the national level, as well as even the revenues at the national and the state level. And our simulation exercise, of course, it was done right after the GST, before the actual price data from these products started coming in. So we estimated that the GST would decrease the price of cigarettes and smokeless tobacco in real terms by 3.5% and 6.6% respectively, while it will increase the BD prices by 6%. That was our estimate back then. And of course, we found that the GST impact would vary widely across different states in India, with both winners and losers out there, simply because before the GST got introduced, there used to be huge statewide variation in VAT rate or the sales tax rate. So there were some states like Rajasthan, for example, which used to apply an extremely higher value-added taxation on tobacco products. On the other hand, there were other states which would apply much lesser value-added tax. So obviously, all those states which were having higher value-added tax rates prior to the GST would experience a fall in the price of these products post GST, because once the GST is implemented, it's the same GST rate that is applied across the country. So you have a uniform tax rates across the country. There's no distinction across states. So the states which were having a higher taxes prior to the GST would experience a fall in price, and as a result, they might experience an increase in consumption, and vice versa. So this was the finding. This was the sole idea of this paper, and it was published in Tobacco Control. Now, let me discuss some of the challenges specific to the GST. As I sort of mentioned earlier, with the introduction of GST, states essentially surrendered their rights to raise sales tax. Before the GST, almost every year, different state governments used to regularly increase value-added tax rates or the sales tax on different tobacco products. So there used to be like an almost annual increase every year in value-added tax. And now with the introduction of GST, the states do not have the right to impose any sales taxes on their own. Changing the tax rates under the GST Council requires consensus from the GST Council, which of course is consisted of both central and the state governments. So, to effect any kind of changes in either the GST rates or structure or anything, it really requires a consensus within the council. And the consensus can be very problematic in a democratic country with a multi-party system. There will be a couple of state governments which are ruled by the same party which is in power at the federal government, whereas there are other states which are ruled by the opposition party. So, coming to a consensus among all the states for the GST Council became a more difficult task. So, and that in fact meant that changing the taxes became more difficult. So earlier the tax advocacy by civil society organization was a little bit more easier, if you may ask me, because civil society organizations could just go and convince the state government and at least get a value-added tax increased in that particular state. And also it could, make representations to the union government or the federal government and, get the taxes or excise duties increased in the union budget annually. These are the sort of things that used to happen. But now, post GST, because this consensus has to be met, the convincing one state government alone is really not going to do much. You have to really go behind every state government and sort of build a consensus among them, or at least have a majority opinion out there, so that any kind of change can be effected. So it became much more difficult. Tax advocacy actually became more difficult for civil society organizations. And I know it personally because I've been consulting to CTFK and similar civil society organizations in India to get exactly this task done over the last many years. Now, also, there were very low GST rates on certain smokeless tobacco ingredients. And of course, the special treatment on BDs, as I indicated earlier, only a 28% GST is applied on BDs, and this additional compensation says that is otherwise applied to other tobacco products and not applied to BDs. And then there are also some other problems with the GST, the way it is implemented. There is an exemption that is given to any businesses with less than 4 million annual turnover. So unfortunately in India, I mean, this is a pan exemption across all the businesses. It doesn't matter whether you are a tobacco business or you are in the business of something else. As long as your annual turnover is less than 4 million Indian rupees, you get an exemption from GST. You don't even have to register for the GST. Unfortunately, in India, a lot of production of BDs and smokeless tobacco products happens in the unorganized sector. And, when you have this kind of exemptions in place, what happens typically is, people split their manufacturing facilities into smaller units to evade taxation. So they get away by not paying taxes, basically exploiting the legal loopholes in here. So this is the unfortunate situation. Now, let me come to the second part of the discussion, which is looking at the affordability of tobacco products in India. And for this paper, this is again a paper by Dr. Esther Dauchi from CTFK and myself. It was published in Tobacco Control. Here, actually, we looked at the actual price data, retail price data from some 6, 7, 8 years prior to the GST and up to 2 years post GST. And we traced the trends in affordability of all the 3 tobacco products, including cigarettes, BDs, and smokeless tobacco products. And we wanted to see how the affordability has changed. Now, why the question of affordability itself is very important in the context of India. I mean, we all know that, when you increase the taxes, typically the prices increase. And when the price increase, we believe it will reduce affordability, and hence it leads to a decrease in consumption. But the catch here is that when the prices increase, it reduces affordability. But that's not necessarily the case all the time, because affordability is determined not just by the changes in prices, but also by the growth in income of the consumer who consumes this product. Okay, so and affordability is also a major determinant for the initiation among youths who are otherwise constrained by income, right? So interestingly, in India, India is a growing country. It's a lower middle income country, so it experiences more than average annual growth in per capita incomes compared to many other countries. In fact, over the last 10 years, I mean, I'm talking about the 10 years prior to the COVID years, actually, India experienced an average annual growth of about 4.8% in per capita gross domestic product. So when you have a steady 5% increase in your average incomes, it's not just enough to increase the prices by 5%. You increase the prices by 5%, your income also increases by 5%. So which means as a share of your income, you can continue to afford the same amount of commodity or same amount of cigarettes that you were consuming before. So you have to really increase the prices more than the increase in income that you experience if you want to make this product more unaffordable and thereby expect the consumption to go down. So we actually looked at how the affordability has changed. For this purpose, we looked at a measure called relative income price. This is a widely used method in the literature. Basically, this relative income price measures the percentage of per capita GDP required to purchase 100 sticks of cigarettes or 100 grams of smokeless tobacco or 100 sticks of BDs. I mean, there are different ways of measuring affordability. I mean, you can look at it in terms of the income that you spend to purchase X amount of the good, or you can measure it in terms of, instead of measuring it in terms of per capita income, you can actually measure it in terms of the wages that you earn. I mean, there are many, literature uses many methods, but this one is measuring it as a percentage of the per capita GDP is more common in the literature. So we used that particular method. An increase in the relative income price over a period would actually mean a product has actually become less affordable and vice versa. So if you see the RIP, the value or the index increases, it means the product is becoming less affordable and vice versa. And in fact, the percentage changes in this relative income price over the years can also be decomposed into a price effect and an income effect. In fact, what it does is you can actually examine when the affordability increases or the relative income price declines by X percentage. This decomposition exercise will allow you to identify what proportion of that increase or decrease in affordability was due to a change in income and what percentage was due to a change in price. So that kind of a decomposition exercise is useful to actually see how effective the taxation policies itself have been. Now here I'm coming straight to the results. This is an overall trend at the national level. The thick lines here, you can see there are lines for BDs, cigarettes, and smokeless tobacco. The line is actually representing the relative income price and its trend. As you can see, the thick line actually shows the actual relative income price over different years in the analysis, starting from 2007-8 till 2018-19. So, and I have also provided a dotted line from 2017-18 onwards. Those and the last 2 years are the post-GST years. And those dotted lines are basically a linear extrapolation of the counterfactual in the event GST was not introduced. So had the GST not been introduced, what would have been this curve post-GST? That is what the dotted line shows. So as you can see here, for both smokeless tobacco and cigarettes, the counterfactual is relatively better in the sense that the counterfactual is giving you an affordability which is slightly less affordable compared to the actual scenario with the GST introduction, where it becomes even more affordable. Whereas that's not the case for BDs. In fact, this finding is very much in line with our paper that I discussed earlier, which actually simulated what is actually going to happen with the introduction of GST. In fact, what we are seeing is that BD has slightly become more unaffordable post-GST, whereas both the cigarettes and smokeless tobacco became more affordable post-GST. But in fact, by towards the second year, you can see that even the BD is, the gap is actually closing down. So it is becoming increasingly more affordable as the time passes. And this chart right here shows this decomposition exercise that I was talking about earlier. As you can see, the price effect is the pink color and the green is the income effect. So whenever there is a price increase, you see that there is a positive effect, or the price effect is positive in the sense it increases the RIP, or the relative income price. And that means it makes the product more unaffordable, or it reduces the affordability. Whereas an income increase has a negative effect in the sense that it actually increases the affordability. And the thinner bars in the middle is the net effect of both the price and the income effect. So you can see that in the very first year after the introduction of the GST, BDs had actually become more unaffordable. We can see a positive RIP percentage change, meaning BD became actually more unaffordable in the very first year post introduction of GST, whereas both cigarettes and the smokeless tobacco products, it became more affordable post GST, and the severity or it actually increased even further. Affordability became even more prominent as you move to the next year, and even for BDs, as I indicated earlier, although it was more the GST made it more unaffordable in the first year post introduction. By the second year, whatever little price effect it still had was more than compensated by an increase in income or the income effect, as a result of which the product actually became more affordable compared to the previous year. So this was the case at the national level, and we have done this. Obviously, this is to be expected because India is experiencing, as I said, on average 5% increase in per capita income. So it is to be expected. Now, this chart here shows the same chart as earlier, but it shows how the percentage change in RIP happened in different states for each of the product. I'll skip through it's unnecessary details, I would say. So let me, in summary, I would say on average, cigarettes, BDs, and smokeless tobacco have become increasingly affordable over the past 10 years in India. And BDs were found to be 9 times more affordable than an average cigarette. You can see that, in India, even though BD is the most highly used to smoke tobacco product in the country, it is priced extremely cheap. So, with the price of one cigarette, you can almost get a pack of BDs, at least 20 cigarettes, at least 20 BDs. So it's the price is at least 20 times higher for an average cigarette compared to an average BD. GST has accentuated the increase in the affordability of cigarette and SLT. There was already affordability was on increasing path. The products were becoming increasingly more affordable, but the GST has actually accentuated that increase. It made the products far more affordable than otherwise. In general, the states with high VAT rates during the pre-GST period experienced increases in tobacco products affordability post-GST and vice versa. Now, that ends the discussion on my paper. Now, for the remaining 2-3 slides, I would like to bring you the current situation, the most current situation at the moment as far as taxation of tobacco products in India is. This is the current taxation structure. Although remember I had mentioned that excise duty was, except NCCD, everything else, including excise duty, was subsumed into the GST when the GST got introduced in the year 2017. But in the year 2019, 2 years down the line after introducing the GST, the union government decided to bring the excise taxes back into the picture. But they brought it back for the namesake. It was a very nominal reintroduction. To see how nominal it is, you can see it, for example, for cigarettes, you're talking about an excise tax of 5 rupees per 1,000 sticks of cigarettes. Now compare that with 2,076 rupees per 1,000 sticks of specific tax alone applied to the same cigarette, and NCCD of 200 rupees or a GST of 28%. So this was a very nominal reintroduction of excise duty that happened. We know that many countries around the world, there is an excise tax that is applied on tobacco products over and above the sales tax or the GST. In India now, fortunately, we have an excise back. In fact, for all practical purposes, even NCCD is also a part of the excise in some way. It is both managed by the federal government. So this is the current taxation structure. Now, the bottom line, you don't have to be lost in these numbers. Ultimately, the bottom line is this last line here. 53% for the cigarettes, that is the total tax burden, tax as a percentage of the retail price, and 22% for BDs and 64% for smokeless tobacco. That is the tax burden. Now you can see where these tax burdens were before the GST 2017-18 and now post 2020-21. This is the present situation. And you can see that the tax burden on cigarettes have actually gone down, whereas there has been a slight increase in the tax burden on smokeless tobacco. Ever since the introduction of the GST, there has only been a minor increase in the national calamity contingent duty. I mean, I'm not counting the reintroduction of excise because it is so nominal that it doesn't really have any impact whatsoever on the prices. But there was a minor increase in NCCD that happened in one of the years post GST. But again, that only had the effect of increasing the retail prices by just about 5%. So it's as good as not having any tax increase. So in effect, the tobacco industry in India has been having a tax-free season for the last 4 years post the introduction of GST. And obviously, the industry's profits have been going up. ITC is the largest, it's a monopoly in the cigarette market in India. You can see that their profit charts are still growing. And there hasn't been any changes in taxation. And central excise tax, while the excise tax constitutes a major chunk of taxation in many countries, right now in India, excise has a very nominal contribution. Excise and the NCCD together is down from 54% to 8%. I mean, I'm talking about the share of the excise tax in the total taxation. Prior to the GST, 54% of the taxes used to be excise. 54% of the taxes applied on cigarettes used to be excise, and now it is down to just 8%. It used to be 17% for BDs and now down to 1%. 59% for smokeless tobacco and now down to 11%. So there's a significant, the excise now has a very small proportion in the total taxation. This is my last slide. Some of the issues I've already highlighted. There's huge discrepancy in taxation. Tax rates are way below the recommended levels. When I say, am I audible now?
Yes, we can hear you.
Yeah, okay, great. So yeah, so there's tax rates are way below the recommended levels. When I say recommended levels, I'm talking about the levels recommended by the WHO, which actually says that the taxes should constitute at least 75% of the retail price, whereas India's tax burden currently is way below that levels. And there is a specific compensation system on cigarettes, as I said, when the cess is specific in nature, unless you revise it annually, inflation, because the ongoing inflation, it can make the effective taxes even lower. And there is a continued complex tier on different tier of tax structure applied on cigarettes. There's a special treatment given to BDs. And the smokeless taxation, although it looks 64% is the tax burden on smokeless, it looks very higher. But in effect, the taxation is very ineffective for smokeless tobacco products because these smokeless tobacco pouches are available in extremely small pack sizes, sometimes up to 1 gram or even half a gram. So the unit price at which these products are available in the open market is extremely low. So even if you have a higher taxes applied on it, the effective retail price is still very low. So these are some of the issues, and here are the papers from which I have made the presentation for the day. So if you're interested, you can refer to this. So thank you, and I'm available to take any questions you have on tobacco taxation in India. Thank you.
Wonderful. Thank you so much, Dr. John. What a comprehensive sort of overview of the taxation, the complex taxation system for tobacco in India. Maybe I can ask you to stop sharing your screen, and for our participants, please go ahead and put your questions in the Q&A box. But let me just get started with one, maybe just to start off the questioning. So in the summary slide, you did mention that the taxes on smokeless tobacco in effect are not very effective, because I guess the actual amount is so small with the packs.
Absolutely.
Do you have any recommendations for how to improve that for smokeless tobacco? Are there any solutions, or is it just impossible to address that?
Yeah. So we have been making a recommendation to bring more standardization onto packaging of smokeless tobacco products. And we've been recommending that smokeless tobacco pouches should be having at least a minimum of 100 grams in each packet, or at least make the unit price of a smokeless tobacco pouch as expensive as the price of the pack of the cigarettes. So that way you have a unit price which is much higher. And in fact, there's also one other benefit to make the smokeless pouches larger in size. That is, it becomes easier to introduce, warnings, pictorial graphic warnings, etc. You can place it more legibly on a bigger package than a smaller half-gram or 1 gram pack. So when you have a 1 gram pack, you would still have the pictorial warnings out there, but nobody would be even able to see that. So yeah, I mean, and introducing a standard 100 gram pack or more, 100 gram or more, at least 100 grams, has been a recommendation that I have been making through many of our published literature so far.
Great. Yeah, that's very helpful. That makes a lot of sense. And is your sense that there's an appetite for doing that, or?
It's nothing in that direction yet, but I can see that the similar kind of recommendation is coming from many civil society organizations, but I mean, it hasn't been decided upon, at least so far. Yeah.
Okay, well, I'm going to move to a couple questions from the Q&A box. So the first question is from one of your countrymen in India. It says, in Karnataka, the chief minister who held the finance portfolio increased the tax on BDs from 5 to 15% in the budget, from the budget presentation in 2017, but within 24 hours withdrew the levy. And so the question is, why is there this hesitancy to move forward with tobacco taxes, and any sort of thoughts you have on that?
But this is a very standard phenomena that happens in India. The interference from the tobacco industry is extremely high. I mean, it's not just in India. I mean, this is a story of tobacco in any country in the world. There's huge interference, although the industry on the one hand would keep saying that, taxes leading to illicit trade and whatnot, but they are scared with the tax increases because that really touches their bottom line. So they will go extra mile to reverse any kind of tax proposals that increases the tax on tobacco products, be it at the state level or at the national level. And in 2017, it was the year before the GST, and that is why the state government could increase the taxes. So, BDs are usually on the lower tax side, and the moment there is an increase in taxation on BDs, there is this huge hue and cry that comes from the BD rollers, who the industry sort of project them as a very vulnerable section in the society. They will lose their jobs and whatnot. But conveniently hiding the fact that it is industry that is actually continuing to exploit these BD workers. So yeah, I mean, I don't know if I answered the question correctly, but it is industry interference, and especially this is true for any kind of taxation on BDs, and that is the reason why even when the GST got introduced, BDs are given a special treatment. They attract the lowest of taxes, despite the fact that that is the one that is consumed the most. And if the government of India really has to target tobacco consumption, they really need to go after the BDs. And unfortunately, that hasn't happened yet, because BDs is marketed as a poor man's cigarettes in India. And the industry keeps saying there's a huge amount of employment that is dependent on BD, and they think that employment is going to hurt if you increase the BDs. But of course, none of this has any kind of empirical background, but this is what the industry story always. And most of the time, any tax increases on BDs, there is an industry pressure to withdraw it. And state governments many times oblige unless they are in a real need for raising tax money from that.
Yeah, thank you so much. And yeah, we see that in, as you said, in all countries. It's just a real challenge to move forward with tobacco taxation. And as a field, we need to sort of learn more about how to be more effective in our communication. So this next question also builds on the politics of all of this. And so we know, and you eloquently pointed out how harmful tobacco is, including in India. But this person is saying, but the government in India subsidizes and gives loans to growers and invests in the tobacco industry. And at the same time, the MPs and ministers hobnob with the industry. Well, the question is this correct? But we know the answer. Again, this is more of a politics question, but do you have thoughts on that?
True. Yeah, the observation is correct. In fact, in India, government of India has a stake in tobacco industry through the life insurance corporation generally. The life insurance corporation is owned by the government, and not just life insurance corporation. The there are a few other insurance companies which are also public sector companies. They all have a stake in ITC and few other tobacco companies. In fact, the LIC, the Life Insurance Corporation, which is a government body, is the largest shareholder of ITC, which is the cigarette monopoly in the country. So naturally, there is a lot of problems here. I mean, on the one hand, you can say if you increase the taxes, governments gain, but if you don't increase, also the government gain. Because if you increase industry profit, that is also beneficial to the government because it has a stake in the company. So that there is some amount of this is a problem here. In fact, there has been public litigation out there by some of the civil society organizations challenging the government's investment in ITC, indirect investment in ITC, and unfortunately, there hasn't been any major resolutions on these litigations so far. Yeah, but there's a clear conflict of interest right there, and it's very evident. And a lot of politicians are invested in tobacco companies. It is common knowledge. Yeah, that's correct. Observation is correct to answer the question. Yeah.
Dr. Khan, you're muted.
Apollo, thank you. So just going back to the focus of your presentation on the GST, I mean, you explained how it made the tax structure more complex, probably not, doesn't reflect the burden of the products, et cetera. So do you think are you saying that it was wrong to move to move the taxation system and fold it into the GST? Do you think that was an incorrect move, or do you think, or there was really no choice and now we have to try and clean things up a bit?
Well, moving to the GST was a historically inevitable choice that the government did. I mean, the GST is a good system compared to the older system because it makes the taxes uniform across India. So it's good that way. But unfortunately, products like tobacco, which are by definition demerit products and has high public health consequences. I wished, instead of making the tax changes more rigid under the GST, there should have been an option to make taxes increase at least annually or often as the government wants. Because you have a fixed taxation on this product, definitely it is going to become more affordable over time. So these are products for which the taxes need to keep going up and to discourage consumption and also to increase the revenue for the government. So unfortunately, at the moment within the GST, it's more difficult because, as I mentioned, changing the taxation within the GST is difficult. But then there is still these components like national calamity contingent duty and excise duty, which if the government really wants, there is a way to change that. There is an avenue to change that. But unfortunately, even that hasn't changed much post GST, and that is where now we are targeting on. Through our advocacies and our deliberations, we have been telling the government to increase at least these components that you can actually increase.
Great, thank you. And given your additional interest in the COVID-19 pandemic, have you been have you had the opportunity to examine the impact of the pandemic on tobacco use in India, including smokeless beading and cigarette use? Have you been looking at it?
That's a very interesting question. I would love to look at, but unfortunately, we don't have really a consumption data that comes in with the regular interval, unlike in many other countries. All that we have in the form of consumption data are global adult tobacco surveys, which actually happens only once in few years. So the last global adult tobacco survey happened in 1670, and the next one is not even started yet. So it's been like for 4 years now since the last survey, you see. So even if I really want to get into such a research, I unfortunately, we don't have the data to carry out. I mean, unless I do some kind of, exercise myself or survey myself. Yeah, it will be interesting to look at, but
and it sounds like, and so apologies, and it sounds like the taxation data isn't available or clean enough to use to as a proxy for consumption, the tobacco taxation.
No. We get the tax rates. In fact, post GST, even the tax revenue data itself has become more or less transparent, I would say. Before the GST, for example, we would get tax revenues from each tobacco product separately. For example, I would know what is the taxes came from cigarettes and BDs and smokeless separately for each product. Whereas now, post GST, the government has been clubbing the taxes or GSTs from all the tobacco products clubbed into one tobacco GST. That really doesn't help. So whatever transparency we had in terms of data sharing seem to have diminished in the recent times, at least post GST is what I can see. That isn't helping.
Right. And I will just reiterate the point that you made, that states aren't able to impose their own taxes now, which is certainly unfortunate, because there are always states or sub-jurisdictions that are willing to go further.
Absolutely.
Well, I think we're at the top of the hour. I really appreciate you speaking to us this evening about such an important topic. I mean, we know all the tobacco users in India, and then how effective a strong taxation system can be. So this is from both those angles, this is such an important, crucial topic. So thank you for sharing your expertise and knowledge with us today, Dr. John.
Yeah. Thank you, Dr. Cohen, and thank you for having me in this important series. I really appreciate it.
Great. Thank you all for joining.